It was just brought to my attention that my microphone wasn't completely operational, so let's go back and start again. So today's talk is going to be about dosing with Elixionl and choosing the right cannabidiol serving size. This is one of the most common questions that I get from professionals about how much to give and what formulation, those special situations. What do I use for a particular condition? And how do I apply and what dosing needs to be used. So I want to go over these very quickly with you. My intent is to give this in a fairly brief presentation, going for about 15 minutes, but try to get to that point where you all can ask questions. We can find out issues that you're dealing with, and I hope to cover as many of the important things as need to be covered that will address your questions and your concerns. So we're looking at the agenda that I have here. Is we're going to talk about the principles of dosing. We're going to talk about a user's guide, for a professional user's guide on how this is going to be done, what is the best pattern and program. Formulations that Elixionl offers, it's going to help you succeed, and it'll be meeting the patient's expectations, as well as how to manage patients and how to orchestrate the use of CBD, since it's such a new entity. How do you use it? How if you run into issues or problems, how do you navigate those issues? As well as how do you make adjustments? And finally, I'll talk about some of the target doses that you might consider for some of the problems that are frequently encountered with using of Elixionl. So one of the main things I want to get across is that everybody is different, and there's no set dose or amount or formulation that is perfect for everybody. So you've got to do some figuring, and that's where your clinical experience and expertise comes in finding exactly what the right formulation is and what the right dose is going to be. Now, I think a great way to start is consider a standard dose in just about everybody. And I'll give you those guidelines and those recommendations. And you start off with a standard guide and the standard dosing, and then make adjustments and be bold with the adjustments, because I'll tell you now and later, there aren't any side effects and there's no adverse toxicity. So you're not dealing with any consequences of getting the wrong dose. The only consequence is that the patient doesn't respond as quickly as you'd like to see them respond. In addition, what we typically see with patients is a response very early in the process. So you can expect a response in terms of some benefit or something that they're feeling or noticing it. And when that happens, then you're looking at them getting some of the benefits and the benefits that go on with this condition. And then early assessment, and I'll emphasize this as we go along. But those are the basic principles, and if you can hold to those particular ones and keep those in mind, I think you're going to be well served. So if we're looking at a standard dose, and I think the standard dose is a great idea, because if you're in doubt, you're not sure what exactly is the right amount for this particular case and this condition, then consider using a standard amount of 15 milligrams twice a day. Now, that's a great starting point. I would say that in 85% of people, you're going to get a response. You're going to find out if it's helping them or if they're feeling it. Now, it doesn't always meet their particular needs. If you're looking at chronic pain or some other strong symptom, you may have to make adjustments to that and may have to increase it. And when you do make adjustments, I'm suggesting that you do that boldly on day one, because it doesn't have any toxicity or significant side effects. Increase those, double the dose, move up very quickly, find out what the right pattern is. And it doesn't have to be twice a day. It can be 3 times a day, especially if they're having breakthrough of symptoms later on let's say, in midday. And you can also adjust the doses so it doesn't have to be the same dose each time. So it could be 15 milligrams in the morning and 30 milligrams in the evening. So be flexible and adjust it to your client's individual needs. What's the best formula? It's the one that they prefer, the one that they're going to take. if the substance is not really, they're not taking it, then it's not going to really do any good for them. So you got to figure out what works for them. In a lot of cases, patients have are very taste sensitive, and so they're going to reject something that tastes really, really strong. So you're going to have to look for something that tastes a little bit better. On the other hand, if the patients are looking for the maximum effect and it doesn't matter what it tastes like, then you might want to go with some of the stronger tasting, but the broader spectrum that contain more of the endocannabinoids, and the entourage that has been shown to be so beneficial with the Elixionl products and cannabidiol in general. And just a small point on that is that with the more entourage that's there, the more effective that the cannabidiol seems to be. Those other helper molecules that are present within the substance seem to enhance the effectiveness and the results. And so that for the maximum effect, you're really looking at hitting something really hard and strong and getting results right away, then you might want to look at the broader spectrum formulations. And I'll talk about what those are exactly in other slides. And then one of the problems that I encounter quite frequently, and so I tell you to assess the patient and the progress very early, and I'm talking about 1 or 2 days, because as many as 50% of your patients, when they take the cannabidiol, deny that they're getting any benefits from it. Now, when I watch people after using cannabidiol, I see changes in them immediately. Those changes may be relaxation of the facial features around the eyes or the mouth, the way they walk, the way they talk, the speed of their language, their cognitive alertness, and their sharpness. All of those things are things that you can see and you can measure just intuitively by the conversation that you're having. If you have the chance to observe them, that's great. I realize that's not always going to be possible, but you can tell a lot from the telephone call, from a conversation that you're having with them as to how they're responding and what benefits. So it doesn't have to be that one specific thing that they're looking for, if it's sleep or anxiety. There may be other benefits that are showing there. And if you can get a hint about what those are and if they're really getting some response, then you're doing well. If they're not getting those kinds of responses, then that's a trigger and an idea for you to increase the dose and make some bold adjustment to see if they can reach an area where they're feeling the benefits, or point out to them that they are feeling the benefits. There's changes are happening with them. They just maybe because it's not in their face, it's not dramatic, it's not like any other substance that's out there in terms of, whoa, I feel this way. It's so subtle that we don't recognize. In fact, it's challenging. When we return to normal, oftentimes we don't feel it. And that's one of the beauties of the Elixionl CBD, is that it gets you back to normal. Well, what do you say about being normal? For a lot of us, that's a very important evolution and change for us. But for some people, they don't recognize that particular change at all. So if you're looking at formulations, and this is a concept that I've recently developed from the xpen concentrate, which has got 10% of CBD in it, and then the capsules about the same. And then you have the tinctures that have maybe 3%, and the liposomes that have even less percentage-wise, but they've got an increased bioavailability. So you can sometimes have improvement and responsiveness there. On the other hand, when you're talking about the concentrate, it is a very strong, spicy flavor that's not to everybody's liking. And so if somebody's going to be taste sensitive, autistics are particularly that way. They have a real problem with the taste or the flavor that something has. And so it may be necessary to go for a better tasting formulation so that they're going to get the cannabidiol into them. Now, the broader spectrum, I think, has probably the top of the line in terms of what Elixionl does with their products. It has that full spectrum to get maximum effect. On the other hand, the liposomes are quite tasty and quite flexible in their use and can be mixed with water, so they're water soluble. The tinctures and the capsules, well, the tinctures particularly, are oil based, so they don't mix well with water, and getting them into other foodstuffs can be a problem. So just a reminder here, when you're choosing a product, that there isn't any toxicity or reactions, and the interactions are really very, very rare. Let's go on to the next the slide and talk about the management. When we're talking about management, we're talking about expecting an immediate response. And oftentimes, when you get an effective dose, depending on the route that you're using, you're going to get a response within minutes or at least 2 hours. Sometimes the capsules take a little bit longer if it's going through the gut, in which case, wait a couple hours, you're going to see a response. They're going to have that response at that time. And so when people ask me, well, how long is it going to take before I feel better? Well, once again, you can expect them to respond very, very quickly. If not immediately, then a few hours after, if they're at the right dosage level. And then I said before, I want you to make bold changes, and I typically tell people to double the dose. Now, if for some reason they're feeling very fatigued, which is one of the side effects that occasionally occurs, especially with the higher spectrum products, then you may need to back off and reduce the dose, and I recommend cutting back to half. And if they have people have more problems with that, then I would like them to go to a topical application, put it on the back of their hands, develop confidence in the use of cannabidiol, and get it to absorb through the skin, which it's really quite effective in its absorption through the skin. Not as good as what it is with going through the mouth and sublingual, but it is comparable in many respects. And if people are really sensitive and they've had some sensitivity issues, then topical may be a great route to get people started with, and then work up to a dose that is ideal for their particular problem. And then, as I said before, you want to reassess them early. Now, you can be with a phone call, but it's really valuable if you can get them into the office, if you can see them, because the changes sometimes are quite physical. I mentioned before about looking at the facial features, the relaxation around the mouth, the way that they move, the way they walk, and how they use their body, as well as their language, their speed of conversation, their cognitive skill in terms of bringing up ideas and concepts and understanding. A lot of that cloud, I hope, will be lifting by the time that they come in, and fairly shortly after the use of it. Now, you're going to get responses, but this may not be the culmination of all of the response that they're going to get from CBD. Typically, I'll see an initial response, and then about 2 weeks in, I see a really pretty good response where the CBD is really working hard for making major changes in the body. And then there are some subtle changes and some integration within the body that occurs at 4 or 6 weeks. And so there's a transformation that can occur with people over that time. So hold out for those changes and so those advanced integrative changes that you're really looking for in terms of making a transformation in this individual. Now, I've got a couple references there at the end of the talk, and I've listed off some of the list of side benefits that occur. So often products have side adverse effects. Well, I'm going to kill you, and I'm going to tell you about the side benefits that are occurring with CBD, because there's nothing really much to say about the side effects, but there's a lot to say about the side benefits. In fact, for some cases, it's a matter of that's the best part of using cannabidiol, because of the extraordinary benefits that do occur with a lot of patients. So that's the management. That's the basis for all of what we're talking about. But you do run into problems occasionally, and we talked about the taste and how to get the right product into people. You can mask it, you can combine it with other foods, you can use things, and I think that it really works well with oil-based foods or fatty types of foods with a snack, and taking it with those foods. But it's well absorbed no matter what, whether there is food or there's not food. I prefer that with some fatty food, there seems to be a better absorption. So that means that they can have chocolate with it. If that's within the regimen that you have, for your clients if chocolate's going to be a benefit for them. And then with tolerance, there are tolerances of two types, and I just mentioned that because the tolerance can be, will they need more of the cannabidiol later on? Actually, no. What I've seen is that over time, they need less. And so that maybe 4, 6, or 8 weeks, you may be able to reduce the dose. And I've seen reductions of doses for people with chronic pain by as much as 3/4 of the requirement for CBD. So it doesn't have to be all the time, and they don't have to keep up with it. This is quite a contrast from other medications that people use that may require continuing doses and continuing increases, in particular the opioids. And then when it comes to allergy, I really haven't found anybody who has shown a true allergy to the cannabidiol and none to Elixionl. Now, people will always complain about some effect that they attribute to using cannabidiol, but I haven't seen anything follow through with that in terms of, yes, this is definitely a reaction. It may be a taste, it may be a concern, it may be some something else that they're taking. And almost in every case, people are taking other supplements and they're doing other things within their dietary program. So, but specifically with regard to allergy, I have yet to find an individual case that I could verify is truly allergic in type. And then I want to talk about a few of the special approaches that you can have with the Elixionl. So one of the things is sublingual, and just to mention, when I talk about sublingual, that's a term that everybody's familiar with, and they understand that, and putting it underneath the tongue. Well, the science actually shows that the best place for absorbing many of the products by mucous membranes in the mouth is at the back of the tongue, the hypopharynx. And where mom used to tell you to gargle is probably the best absorption. And that was done with using some products, some cannabinoid products, as a matter of fact, Sativex, as a spray. And that particular product was best absorbed at the back of the tongue. And so that's one place. But when it comes to sublingual, I tell people to swish it as well, and rather than keep it underneath their tongue, I just like to have it in contact with the mucous membranes as long as possible, because you get that direct absorption. And with direct absorption, then you're going to bypass the first pass effect on the liver when it metabolizes the substance and deactivates a good portion of it. So the sublingual and through the mucous membranes is going to skip that part of it, and you're going to get higher blood levels immediately and a rapid effect. So that's a great way to confirm to the patient that they're really getting benefits from using the cannabidiol. They can feel them, and they get this wonderful onset right away. So it's a valuable approach to it. And then I did mention about topical. So when you can use topical, and you can use it on any skin. My experience is that the back of the hands is a great place to put it. It can sometimes stain the clothes, so you want to be somewhat careful about using it and where it's located. But it can go on the abdomen, it can go on the back, it can go on the thighs, wherever it's really convenient for the patient. And topical is also in more than just getting the cannabidiol into the bloodstream for some generalized symptoms. It's also for local symptoms, applications to injuries or trauma, to wounds, to viral lesions and sores. Really extraordinary in terms of the immediate relief and analgesia that it can offer. An acute burn can be applying this on it. It really takes away the pain. And you're going to have to reapply it on a regular or frequent basis every 3 or 4 hours. But during that first day, but you can avoid the blister formation. You can avoid a lot of the complications by using this immediately. So it's a great product to have in the medicine cabinet so that you can use it when those minor traumas come up, as well as treating the overall problems. And then suppositories in our country, we don't really use suppositories very much, but essentially this is mucous membrane absorption. And so you're going to skip the first pass effect by the liver, and you're going to get higher levels. And because when you're using it as a suppository, then you're going to be maintaining that mucous membrane contact for an extended period. And that way it'll get absorbed better. You're going to get more complete absorption, and it's going to be a direct absorption. Now, the cannabidiol products, they don't come in a suppository, but it's easy enough to mix something like that through your pharmacist, or making your own with some cocoa butter, and forming that and deciding what your dose is going to be. It might be particularly valuable in children who have who may be object to the taste or the flavor, and you want to use the best product. If you can use suppositories, it may be a great approach to doing that. Now, one of the things I want to talk about, and once again, everybody's asking me about this, is, okay, how much do I use? And so I wanted to give you a few examples to give you the full range of my experience using cannabidiol. That the standard approach is like 30 milligrams a day. That's a good base starting point. It'll take care of almost all of your patients, and it's a good point to start with for them to get familiar with it, and for you to use if you don't have any particular other inclination in terms of what the right dose or the right target is for their condition. Because everybody's different, many people are going to respond to the 30 milligrams without any difficulty, but you may have to increase. And so that's why I've put these as general targets for different conditions. And I think you can get the concept here that we're talking about. If we're talking about autoimmune or chronic pain, and 60 milligrams is going to be a target area that you need to get to. You certainly can go higher than that, but that may be if you're not getting the benefits and the patient's not responding as well, then you may need to push up to that dose, encourage the patient to take more. If it's cancer, I find that 90 milligrams is a great dose, and that's a per day dose in all of these, and that seems to be very effective. I've had good success. Clients have reported resolution and improvement with cancer using that dose or a little bit lower. So that's very good. And it's a good target area for you to consider. The other area is, and probably the most significant, is the fibromyalgia and the Lyme disease. I've had to go up to very high doses with that, about 180 milligrams in many cases. But many times I'm able to reduce that dose after a short period, so that we're talking about 2 or 4 or 6 weeks. They're able to reduce the dose, get it back down to a more normal level and a more affordable level at that particular point. I'm really not seeing a whole lot of benefit to going over 200 milligrams for anybody for any condition. It's very possible there are those people out there. I just haven't encountered them at this particular time, nor have I really been willing to push the dose higher than that if I'm not getting much of a response. Those people who have gone up to double that dose, maybe 400 milligrams, really haven't shown any particular special response that I can report. And they're so rare. I haven't seen any of those cases in a long time. So let me just recap. I want to finish up here and open everything up to some questions. We're talking about a lot of personal variation, that each of your clients is going to be different. There's a standard approach that will never be wrong for you in terms of starting out and getting somebody started on cannabidiol. And then early adjustments, that's a real key and perfect for you as a clinician to apply cannabidiol to get it working and to interface with the patients and learn about what responses they're having and when they're having those responses. And then monitoring in terms of what kind of things that they're making improvements on, about checking with them and the frequency. I like to do frequent checks because people don't realize what they're doing. And so much of the time, patients misunderstand the directions that I've given them, and they're not taking it as I've recommended. They're taking it once a day instead of twice a day. They're using it at inappropriate times, or they're actually having difficulty and have been reluctant to come in and check on that. So That's going to finish up the general talk, and I wanted to open this up and to some questions, but I also wanted to share some of those some standard guidelines that I have set up, and it's available at this location, this URL. It's got those for you. You can take a look at those and review those, as well as the slides for this presentation that have been placed at that particular website. So I think that'll be a good resource for you. You can go back and reflect on those things. And so at this point, I want to open it up to questions and have you type in your questions in the chat area, and I'll answer those as they come through. And I really look forward to answering your questions and meeting all of your particular needs and what we can do for you. So go ahead and send me a question on the chat, and I look forward to answering those questions. And if we don't have very many questions, then I hope that I can. You'll find success with Cannabidoil, and you'll learn from your experience and how it's best used, and have the great success that I've had in the last 3 years working with Elixionl. Well, it's a real pleasure for me to talk to everybody. There wasn't a specific question, but felt like one of your members said felt like this was pretty helpful. Gave them the down and dirty information they need to get started and to apply this in many patients. But I'll look for more questions if anybody's got anything on the line, concerns that they have. Well, that's great. I don't have any specific questions, so that means I either did a really good job and you understand everything, or, oh well, we won't go into the other part of that. But look at if you have questions and concerns, I certainly would like to answer those. And if you need special coaching or you'd like some additional information, then we're going to be having these frequently asked questions and try to address some of the professional concerns on a weekly basis. Try to get the word out and try to get explanations for how things work and answer a lot of the questions that you do have. I do have a question about what's the concentration, what concentration do you recommend either in the, whether it be the 300 or the 3600? Well, that's interesting because the 300 milligram tincture, and I assume that we're talking about the tincture, and the 3600 is a tincture as well. The 3600 is 30 milligrams per milliliter, which is a great concentration, and it's the one that I found to be probably most effective all the way around. But the price point is a little bit high for people not sure about the product. So the 300 milligram is 10 milligrams per milliliter, and that's not as, it won't last as long. When you find somebody who is responding to cannabidiol, the 300 milligrams is only 30 milliliters, and if you're using 30 milligrams per day, you've only got 10 days supply. But it may be a great starting point to find out if cannabidiol is going to be effective for them. And I'm very confident it will be, but they've got to be assured that it's going to be working for them. And so this could appear to be like a sample for them. This is where they can test out and find out what is the right amount. And when you're using the 300, you don't have much time. You want to get them to a therapeutic level very quickly. So double the dose, get it up to where they're feeling the benefit from it. And when they start to feel that benefit, then they're seeing that what's happening, then you may need to lead them to using the 3600, which has got 120 milliliters in it and will last them 2 months or at least a month, so that they can get the long-term benefits that we're seeing with Elixionl. So depending on the wariness of your client, starting with 300, if they're wary and they're not sure and they're cautious, versus the 3600, which is that long-term approach, we're going to change it. We're going to transform your life using Elixionl, and that may be the best product. So one of the questions was, can you explain why the xpen has more of the full spectrum effect? Yes. One of the things that I wanted to, what we see is that the broadness of the entourage, the associated cannabinoids, as well as the phenols and the flavonoids that are contained in the xpen may add that extra edge and improvement in terms of the responses that people get using Elixionl. So there's complex cases where you're dealing with some difficult problems that may be multimodal, things like fibromyalgia, where there's a host of problems that are going on, and it's never just one thing. They may respond better to something with a broader spectrum that includes some of the other cannabinoids, those helpful cannabinoids, not THC, but those other helpful cannabinoids, as well as the terpenes and the flavonoids and the polyphenols, those things that are known to be entourage, they're beneficial and lifting up. One of the problems that, and I don't think that the pharmaceutical industry is ever going to have a better product, because they take out the entourage. They remove those other substances. It's not a biologically derived substance. It tends to be more artificial and extracted. It doesn't have that entourage. So they're never going to get to the level of effectiveness, I believe, without using some or more of these products. And that's not part of the pharmaceutical industry and what they achieve. So I think that Elixionl and these more natural, full plant products are going to offer a lot more benefits to a broader number of people, rather than exclusive extracts that are coming that are pure in any way. The chemistry, of the pharmacokinetics of these substances also changes dramatically when you isolate the molecule of CBD versus having it included with its entourage. So it's really good to have the entourage, but I realize that it's really strong taste, and sometimes people can feel the effects of the entourage a little bit more than what they feel with the cannabidiol. And so that they may get some extra fatigue, and they might have some other symptoms that might come on by using one of the broader spectrum products. It all depends on your client and their particular need, but there's a lot of flexibility here. So feel free to make adjustments and find out what is the special need for your client. Now, there's some new products that are coming out from Elixionl. There is a healing balm that is being offered, that's now available, and it's a topical application that can go onto the skin. It doesn't have high concentrations of CBD, but it's very healing and very soothing. It's not a cream, because the mixture is designed really for soothing the skin, and it doesn't have any water products in it. So that means that it has a long shelf life, and you don't have to worry about any disintegration of the product. So it's an excellent product and great, as well as a lip balm that can be used and applied to the lips, and doesn't have any adverse effects, and it improves the effectiveness on the lips. And so for those special things, and maybe cuts or abrasions, as well as just dry lips, it's a marvelous product that is quite effective for that. Explain the difference between Respira and hemp oil 300 milligrams. I'm having a little trouble with understanding what Respira, what that is. I wonder if you could help me with that, clarify that. Certainly I know of hemp oil. Oh, Respira is our vape product. Fabulous. I was not aware that it was available. Unfortunately, I'm not able to talk about that right now. I haven't come prepared. I'll have to brush up on that and find out what's being offered in terms of the vape product. Christy, I want to thank you. And I was not aware that of what was going on with that. So it's really good to hear. And I think the vape is a great approach because you're going to get delivery directly to the lungs, and that means direct absorption. That sort of stuff goes right to the brain. And so particularly for many conditions, and you're going to get really good absorption, you're going to get a direct effect, and you're going to get a concentrated effect with a minimal metabolic processing by the liver. So that very low doses may be able to use on some of these conditions that you're encountering. And that may be more cost effective for a lot of people. I'm not sure about the duration. Typically, what I've seen is maybe a 4-hour, a decreased duration of effect. What I see with the capsules is often 12 hours results, and the tincture's a little bit less. But with the vape product that I have experience with has been about 4 hours in terms of the duration. Nevertheless, the vape product those types of things are really easy to use, and they can be titrated to the amount of puffs that somebody takes, as well as the depth of inhalation. So you've got a really wide range that people can use on it. A lot of people are going to be concerned about, well, can I be harming my lungs? And there'll be a lot of caution with it. And my experience in having seen these products used is I've never encountered any difficulty, and huge benefits. People with COPD or with asthma, they've responded terrifically to using vape products with really good results. So I'm confident that this is going to meet the mark very, very effectively for a lot of the problems, and be higher bioavailability, even higher than the liposomes, which we consider an extremely bioavailable, maybe 5 to 10 times bioavailability of the tinctures or the capsules. So this is wonderful, and I'm really delighted to hear that they've released this particular product, because I can think it can benefit a lot of people and get them moving to transformation. It's not going to be for everybody. Not everybody's going to feel comfortable with using vape and this new technology, and they're going to be concerned about cigarettes and will it damage my lung. Those are difficult things, and I know that you're going to have to get your experience to decide whether that's appropriate for your patient and what the problems that they may be encountering. Well, I think that we're going to close off the webinar at the present time. It was great to have you, and I appreciate the questions that you had. And I hope this has been informative and instructional for everybody, and it'll be a valuable resource for you. Thanks again for attending, and I look forward to seeing you next week. Goodbye.